Edutainment Studios welcomes you to Health Insurance, Knowing Your Options. This module is part 2 of a 6-part series on health insurance. Health insurance can help you stay healthy by paying for all or part of the medical care you need. However, it is easy to feel overwhelmed with today's health insurance options and requirements. There are more types of health insurances to choose from than ever before. All of these choices, along with new laws created to protect you, make choosing a health insurance plan more confusing than ever. At the same time, the health insurance providers are putting more expectations on you to take greater control of your own health care. In this course, the objective is to help you list the different types of health insurances. The most common type of health insurance plans is called managed care. Managed care plans focus on controlling costs and offering plan member medical services at the lowest rates possible. This is accomplished by forming networks of participating providers who all agree to charge the plan members a reduced fee. If you have a managed care plan, you will usually pay a lower premium and have less paperwork to fill out and track. However, in order to take advantage of these savings, you must utilize doctors and hospitals that are in your plan's network. Additionally, in a managed care plan, once you join the plan and choose the benefit package that you are comfortable with, the only other thing that you will get to control is who your primary care provider is. Once that is done, and you're added to that doctor's roster of patients, all other decisions regarding your care are handled by the primary care provider, PCP, and you. You cannot go wherever you want to get services. All care is governed by the PCP in partnership with you, but within the plan network. Managed care plans are very common today, especially through employers who offer health insurance as a benefit. They are gaining in popularity in the federally funded Medicare program in leaps and bounds, as they provide the biggest bang for the buck for people who have limited funds to spend on health care. There are 4 basic types of managed care plans: HMO, which is Health Maintenance Organization; PPO, which stands for Preferred Provider Organization; POS, or Point of Service; and EPO, which means Exclusive Provider Organization. The differences between each of them are usually based upon whether or not a referral is needed, and if out-of-network services are covered or not. A referral is when the primary care doctor has to approve any visits you have with a specialist. In and out of a network situation, services may not be covered at all, and if they are, they will most likely be at a higher cost to you. Under each type of plan, you will generally have a choice of more specific plans. The specific plans vary on the amount of coverage you will get and how much the plan will cost. Not all insurance providers describe their plans the same way, and they may not all fit within the categories we have broken down. It is safe not to assume that certain types of plans will have specific types of coverage. Check with your insurance provider for the specific benefits you may be interested in. It is a good practice to compare carrier by carrier and plan by plan side by side, in order to make the correct selection based upon your particular needs. If you qualify, there are government health insurance plans that provide low-cost or no-cost coverage. The 2 main government health insurance programs are Medicare and Medicaid. Medicare is available for people who are 65 or older. If you have not yet reached 65 but have a disability or permanent kidney failure, you may also qualify. Similar to managed care plans, a monthly premium is usually required. Costs are shared through deductibles, copays, and coinsurances. Medicare has several options with multiple parts. The first option is the original Medicare, Part A, involves and pays for hospital expenses. Part B refers to outpatient care, lab services, and preventative services. Part D is an optional add-on that provides prescription medication coverage. The second option is a Medicare Advantage plan, which is also referred to as Part C. These plans are similar to the original Medicare plan, except they are organized by private insurance providers. While still being overseen by the government, they provide the same type of coverage as original Medicare, but they include prescription, vision, and dental coverage as well. In some cases, a Medicare Advantage plan may be less expensive than original Medicare, once Part D and supplements are added. A Medicare supplement insurance plan can also be purchased. These plans are sold by private insurance providers and pay for some or all of your deductibles, copays, and coinsurances. You can visit www.medicare.gov to see if you qualify for coverage and to view all of your options. Medicaid can be obtained if your income is below a certain level and specific criteria has been met. Unlike Medicare, Medicaid is implemented and supervised by each state's government, while still meeting the guidelines set up by the U.S. government. There are mandatory benefits that the state must cover, as well as optional benefits that can be chosen by you. Also, depending on the state, you may still be responsible for some deductibles, copays, coinsurance, or a low monthly premium. www.healthcare.gov/screener is another great site where you can check their Medicaid qualifications. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 6-part series on health insurance, and come back for part 3.